From CBS 4, this is Haystack TV, powered by HaystackHelp.com. Finding reliable services can be like finding a needle in a haystack. With HaystackHelp.com, finding the needle just got a lot easier. Now, here's the host of Haystack TV, Mark McIntosh.
Nearly 24 million people in the United States have diabetes. Most of them suffer from type 2 diabetes, and many report frustration despite their physician's best efforts for those struggling with type 2 diabetes. We have a new approach that just might be what you need. Doctors Brandon and Heather Crater are here to discuss their new treatment approach to diabetes. It is changing lives, and thanks for joining us. Great to see you guys again.
Good to see you.
And Dr. Brandon, we'll start with you. You know, type 2 diabetes, despite all the medications, diets, and exercise program, it continues to be a very frustrating situation for a lot of people. Why does the disease create so much frustration and, unfortunately, destruction?
Well, what we find for most people who get diagnosed, typically on a routine physical, they go in for some other health problem, and the doctor comes back with test results saying, "I'm sorry to say that we found out you're a type 2 diabetic." And really, that's the start of the frustration. They get their first medication, and that's typically the road that they go on. It's one medication after the other. Every time they have a health problem or a symptom comes up or their blood sugar is not in control, that's typically the next answer. Increase the medication or add another medication. And then they get the blood pressure medications, the cholesterol medications. Their energy levels are depleting, their quality of life is decreasing, and all the while they're gaining weight when the doctor is telling them, look, you got to do something to lose the weight. And the fact of the matter is they struggle with it. So they get very frustrated with this back and forth drug therapy approach. They can't lose the weight, and they tend to get worse with time.
Wow, and you all are getting great results. And Dr. Heather, so what are you doing differently that is not like the typical approach to this drug therapy?
So what we're doing in our office is we're actually looking at each person as an individual, not saying, oh, you're a diabetic, here is the protocol for what you're going to get, this is how you treat it, but truly looking at each person as an individual, because as you know that everybody's different, and there's many different reasons for why people actually have diabetes. Most of them are told that, oh, your pancreas just isn't working, but in reality, that's very rare. And there's a lot of other things that are going on in the body that create diabetes, and truly looking at what is causing it, because unfortunately those medications that are commonly prescribed for diabetes are just treating the symptoms. They're not really getting to the cause of what's going on with them.
That's great information to have. And Dr. Brandon, what type of results are you seeing?
Well, we're seeing tremendous results. I mean, when you get down to the root cause of a person's problem, as Dr. Heather was talking about, and you customize a treatment program for each patient, as opposed to everybody gets the same basic medication, we are truly seeing patients able to reverse their diabetes, plain and simple. They're able to get off their need. Their need and dependency for medications are reduced and eliminated. I mean, they're able to get off insulin, all their oral diabetic medications, blood pressure medications, cholesterol medications. They actually are able to lose weight without exercise because their body's starting to work properly again. Their metabolism is being boosted. And you look at their follow-up lab tests, it's very clear to see that they are truly reversing their diabetic process. And that's what we see pretty routinely in the office.
You know, and Dr. Heather, for a lot of these people, you know, they've been told for years you can only manage this, but that's not the case.
That's right. So typically drug therapy does manage diabetes, but what we're looking at is something completely different. We're taking a different approach to truly find the cause of what's going on, and when you address the cause of why somebody has diabetes, then you can actually reverse the disease process.
Very quickly, got about 20 seconds. You got a special offer for our viewers out there?
Yes, for the first 20 Haystack viewers, we're offering a complimentary consultation.
Fantastic. It's great seeing you all, and thank you for the great work you guys
Thank you.
are doing. All right, the solution to your suffering is only a phone call away. If you would like to see if you qualify for a type 2 diabetic evaluation, please call 303-302-0930. The first 20 Haystack viewers to call, if they qualify, will receive 2 free consultations. That's a $490 value. Don't delay. Make that call right now. 303-302-0930. To learn more, simply go online to their website, drcrater.com. Thanks for watching, and remember, HaystackHelp.com is a free consumer referral service. You can find more reliable companies like the Doctor's Crater by going to HaystackHelp.com. Many of the millions of Americans who suffer from type 2 diabetes report lots of frustration with traditional treatments. Today, we share a new approach that might be for you. Doctors Brandon and Heather Crater are here to explain. Great to see both of you.
Good to see you.
And Dr. Brandon, why does diabetes continue to be so frustrating and destructive for so many people?
Well, I think the whole process is frustrating for them. For many diabetics, they get diagnosed, and at the very next thing, they get a prescription for their first diabetic medication. And continually, it tends to be one medication after the other. Blood pressure medication, cholesterol medication. They continue to gain weight. And really, in the back of their mind, they feel like a ticking time bomb because of the fear of the complications of the disease, the loss of vision, increased risk for heart disease, kidney failure, these types of things. They're very frustrated because they see themselves getting worse with time, not better.
Dr. Heather, what then is your approach and what type of results are you getting?
Typically, what we do in our office is look at each person as an individual, and most people just want to know why they have diabetes. And when you understand why, and you know the cause of why somebody has diabetes, and we actually see that that disease process can be reversed. And so most people are able to get off their medications across the board and really start to lose weight without exercising and feel much better.
Well, what I love about you guys, you're offering hope to a lot of people who think there is no hope out there. So thank you very much, and thanks for being here.
You're welcome.
Thank you.
All right, if you would like to see if you qualify for a type 2 diabetic evaluation, please call 303-302-0930. The first 25 Haystack viewers to call, if they qualify, will receive 2 free consultations. That's a $490 value. Pick up the phone, 303-302-0930.
From CBS 4, this is Haystack TV, powered by HaystackHealth.com. Finding reliable services can be like finding a needle in a haystack. With HaystackHealth.com, finding the needle just got a lot easier. Now, here's the host of Haystack TV, Mark McIntosh.
Many women taking hormones for an underactive thyroid often find themselves frustrated even though their lab ranges come back normal. They still can't seem to shake the symptoms associated with low thyroid. Doctors Brandon and Heather Crater join us now to explain why women with low thyroid continue to suffer even though they are taking thyroid hormones and have been told their thyroid is normal. And thanks for being here. It's great to see you guys again. And Dr. Brandon, we're going to start with you. Why is hypothyroidism so frustrating for patients?
Well, for most patients, they were living with mounting symptoms. They can't lose weight. They continue to gain weight. They can't lose the weight even if they exercise religiously, even with a good diet. They have fatigue, depression, constipation, anxiety. These mounting symptoms continue to occur, and they find themselves into their physician's office, and really it sounds obvious that it's a low thyroid issue. And so they run the thyroid test, they're diagnosed with hypothyroidism, they get the hormone medication, so they're taking the thyroid hormones, and doc says, hey, look, your thyroid's now fine, and things continue to take the medication, but the fact of the matter is the symptoms do not go away. And for many patients, the symptoms continue to get worse, and that's very frustrating to people because they think, hey, I got the diagnosis, I have the right medication, why isn't it working?
Exactly. And so, Dr. Heather, what's the number one reason women being treated for low thyroid are still suffering?
What we find is that there is a number one cause for low thyroid that's not being checked. And so you really have to figure out what these patients are going through. Again, every single person is an individual, even though they may have the same diagnosis of low thyroid, but really getting down to what is causing the thyroid issue in the first place and where are the other imbalances in the body, because sometimes there's other organs that have the same symptoms of dysfunction that the thyroid has as well. And so you really have to be very thorough and looking at the entire body and the entire endocrine system to figure out where those imbalances are.
Yeah, great advice. And Dr. Brandon, is it true that more often than not that these symptoms for low thyroid can lead to more serious illnesses?
Well, and that's a big problem for these patients. And when the physicians are not checking for the number one cause, as she referenced, which we don't have a lot of time to talk about today, when they're not checking for this disease process, and if it continues to fester, we do see people develop other serious disease processes along the way. And it's pretty sad because, you know, with just a few simple tests, you can really determine what's really driving these symptoms for people and really get to the root of them so they don't get worse with time.
And Dr. Heather, what are the typical results you see with an accurate diagnosis and the proper treatment?
So typically what we see is that these symptoms really start to go away. I myself have been diagnosed with low thyroid, and at one point I was 50 pounds overweight. I exercised and I've been on every diet.
And why isn't this working?
It was really frustrating for me, but whenever you look at the body and truly figure out the underlying imbalances and the causes of these symptoms, then you really start to reverse all of those symptoms, and patients start to feel better. They have a lot more energy. They start losing weight. They can sleep better at night, and they have much more tolerances for children, relationships, work.
That's fantastic. You have a special offer for our viewers out there.
We do. The first 25 callers will receive a complimentary consultation.
Fantastic, and thank you so much for what you're doing for so many people. Appreciate
Thank you.
that.
Thanks for having us.
All right, the Doctor's Crater want you to make a firm commitment today to learn about the many treatment options for women still suffering from low thyroid symptoms. All you got to do is call 303-302-0930 or visit drcrater.com. The first 25 Haystack viewers to call, if they qualify, will receive 2 free consultations. That's a $490 value. This offer is exclusively for women who have been previously diagnosed with low thyroid and are taking medication. The phone number again, 303-302-0930. Thanks for watching, and remember, HaystackHelp.com is a free consumer referral service. You can find more reliable companies like the Doctor's Crater by going to HaystackHelp.com. Many women taking hormones for an underactive thyroid often find themselves frustrated. Today, Doctors Brandon and Heather Crater join us now to share an alternative approach. Great to see both of you again. And Dr. Brandon, we start with you. Why does hypothyroidism continue to be so frustrating for so many women?
Well, for most of these women, they've been diagnosed with hypothyroidism. They've been given the prescription, which is a standard of care approach, the thyroid hormone replacement therapy, but they continue to suffer with symptoms, depression, anxiety. They can't lose weight, even with a good diet and an exercise regimen. They have constipation. They can't sleep well. They're losing their hair. They continue to suffer, and a lot of times these women are getting worse with time. In the majority of cases, their lab ranges are normal.
Yeah.
And they're very frustrated.
Yeah, I can understand why. And so, Dr. Heather, what is your approach and what type of results are you getting?
Well, the number one cause of low thyroid is often being undiagnosed. And so we're looking at each of these patients as an individual and doing the appropriate testing to figure out what else is going on and what is the cause of their low thyroid. So we customize an individual treatment plan for each person depending on what we find in all of the testing that we do.
Well, and I know from a lot of the testimonials you're getting, you're offering a lot of hope for a lot of people. So thank you very much. We appreciate that very much. All right, to learn more about the many treatment options for women still suffering from low thyroid symptoms, all you got to do is call 303-302-0930. The first 25 Haystack viewers to call, if they qualify, will receive 2 free consultations. That's a $490 value. The number again, 303-302-0930.